What if I told you that a hospital knew a pregnant mother had a severe uterine infection, knew that the baby was in distress, and still chose to delay a C-section? And as a result, a child was born with permanent brain damage that was 100% avoidable. That's exactly what happened in Pennsylvania, and the jury awarded $180 million. It's the largest medical malpractice verdict in the state's history. Let's get into it. Hello everybody, welcome back to The Verdict Doctor. This is the channel where we look at recent medical malpractice verdicts in courts across the country, try to understand what happened, what went wrong with the medical care, with an eye towards preventing you as the patient or a family member from experiencing something similar. So the case we're looking at today was decided in Philadelphia in 2023 against the hospital of the University of Pennsylvania. This is not some small community hospital. This is a major academic medical center, one of the most prestigious in the country. And the facts here are really hard to stomach. A mother came into the hospital to deliver her baby. During labor, the medical team identified that she had developed a severe uterine infection called chorioamnionitis. Now, chorioamnionitis is a serious complication, but it's also one that OB/GYN teams deal with regularly. The standard response is to expedite delivery, but that's not what happened here. Despite the baby showing signs of fetal distress on the monitoring strips, the medical team delayed performing the C-section. We're not talking about a minor delay. We're talking about a delay that allowed the infection to progress and the baby's oxygen supply to be compromised. By the time they finally delivered the baby, the damage was done. The child suffered hypoxic ischemic encephalopathy, HIE. The consequences are devastating. The child has cerebral palsy, permanent brain damage, and is completely dependent on others for his care. The standard of care in obstetrics when you have chorioamnionitis and fetal distress is clear. You deliver the baby. You don't wait. What the defense tried to argue was that the decision-making was reasonable. They called it clinical judgment. But the jury didn't buy it. The jury awarded over $180 million. That number reflects the lifetime cost of caring for a child with severe cerebral palsy. So what can you do? First, have an advocate in the room, someone whose only job is to watch what's happening and ask questions. Second, ask about the fetal heart rate monitor. You're allowed to ask what it's showing. If you see concern, ask why. Third, if someone mentions an infection, ask what the plan is. Make them articulate it out loud. It forces them to act. And fourth, don't be afraid to be the difficult patient. When it comes to your baby's brain, safety is more important than being polite. So that's the Penn case. $180 million because a hospital delayed when the signs were screaming to deliver. A child's life changed forever. Remember, this analysis is for educational purposes and does not constitute legal or medical advice. Consult with an attorney if you suspect malpractice. Thank you for watching. If you found this helpful, please like and subscribe. Drop a comment with your story. I'll see you next time.